Anemia is a medical condition characterized by a decrease in the number of red blood cells, RBCs, or a decrease in the amount of hemoglobin in the blood. Hemoglobin is a protein in red blood cells that carries oxygen from the lungs to the rest of the body's tissues. Causes of anemia. Number 1. Blood loss. Acute blood loss from injury, surgery, or childbirth. Chronic blood loss from conditions such as gastrointestinal bleeding, ulcers, colon cancer, or heavy menstrual periods. Number 2. Decreased red blood cell production. Nutritional deficiencies, iron, vitamin B12, folate. Bone marrow disorders, aplastic anemia, myelodysplastic syndromes. Chronic diseases, chronic kidney disease, rheumatoid arthritis. Infections, HIV, tuberculosis. Inherited conditions, thalassemia, sickle cell anemia. Number 3. Increased red blood cell destruction, hemolysis. Inherited conditions, sickle cell anemia, hereditary spherocytosis. Autoimmune disorders, immune hemolytic anemia. Certain medications or toxins. Symptoms of anemia. Fatigue. Pale skin. Dizziness or lightheadedness. Headaches. Cold hands and feet. Irregular heartbeat, arrhythmia. Diagnosis of anemia. Blood tests. 1. Complete blood count, CBC, to measure RBC count, hemoglobin, hematocrit, and other parameters. Peripheral blood smear, to examine the shape and size of RBCs, iron studies to assess iron levels and iron binding capacity. Vitamin B12 and folate levels, to evaluate for deficiencies. 2. Bone marrow examination. In certain cases, a bone marrow biopsy may be performed to evaluate bone marrow function and rule out underlying disorders. Treatment of anemia. Iron supplementation, for iron deficiency anemia. Vitamin supplementation, for vitamin B12 or folate deficiency anemia. Erythropoiesis-stimulating agents, ESAs, synthetic hormones that stimulate RBC production, used in certain types of anemia associated with chronic kidney disease or cancer chemotherapy. Blood transfusion, for severe anemia or acute blood loss. Medication adjustment or removal, if anemia is caused by medications or toxins. Treatment of underlying conditions, addressing the underlying cause, such as managing chronic diseases or treating infections. Anemia can have significant effects on overall health and quality of life. Early detection and appropriate management are essential for effective treatment and prevention of complications.